Hi, my name is Johnny Ramos and I am going to talk about frontal sinusitis causing epidural abscess and Puffy tumor. Definition: it's when the sinus cavity behind your forehead becomes inflamed. It is known as acute frontal sinusitis. Sinus can become inflamed in the mucous membrane to produce too much mucus, and infections and other health conditions can also sometimes cause acute frontal sinusitis.
Is Dr. Carlo Maget, emergency physician and founder of EDExitvideo.com. To find videos like this related to the care of emergency care patients, please come to EDExitvideo.com. Epidural abscess. An epidural abscess is a collection of pus or infected material between the outer layer covering the brain and the spinal cord and the bones of the skull or spine. The abscess causes swelling in that area. Causes, incidence, and risk factors associated with epidural abscess. First, epidural abscess is a rare disorder caused by infection in the area between the bones of the skull or spine and the membranes covering the brain and spinal cord, the meninges. This infection is called an intracranial epidural abscess if it's inside of the skull area, or a spinal epidural abscess if it is found in the spine area. Most of them are located in the spine. The infection is usually caused by bacteria. Staphylococcus aureus is the most common organism, but may be caused by fungus. It can be due to other infections in the body or germs that spread through the blood. However, in some patients, no other source of infection is found. In the case of an intracranial epidural abscess within the skull, the risk factors include chronic ear infections, chronic sinusitis, head injury, mastoiditis, recent surgery. A spinal epidural abscess may be seen in patients with a history of back surgery or invasive procedures like epidurals and injections. Bloodstream infections like boils, especially in the back or scalp, bone infections of the spine or vertebral osteomyelitis, and people who inject drugs are also at increased risk of this disease. Symptoms: spinal epidural abscess, bowel or bladder incontinence, difficulty urinating or unable to urinate, fever and back pain. The symptoms of intracranial epidural abscess include fever, headache, lethargy, nausea and vomiting, and pain at the site of recent surgery that gets worse, especially if fever is present. Neurological symptoms depend on the location of the abscess and may include decreased ability to move any one area of the body, loss of sensation in any area of the body, or abnormal changes in sensation, weakness. What are the signs and tests for epidural abscess? A healthcare provider will perform an exam to look for a loss of function, such as movement or sensation. Tests that may be done include a complete blood cell count or CBC, a blood culture, a CT scan of the head or spine, an MRI of the head or spine. What is the treatment? The goal of treatment is to cure the infection and reduce the risk of permanent damage. Treatment usually includes antibiotics and surgery. In rare cases, antibiotics alone are used. Antibiotics are usually given through a vein or IV for at least 4 to 6 weeks. However, some people may need to take them for a longer time, depending on the type of bacteria and severity of the disease. Surgery is usually needed to drain or remove the abscess. In addition, surgery is often needed to reduce pressure on the spinal cord or brain to prevent further loss of function. What are the expectations or prognosis of this disease? Early diagnosis and treatment greatly improves the chance of a good outcome. Once weakness, paralysis, or sensation changes occur, the chances of recovering lost function are reduced. Permanent nervous system damage or death may occur. Complications. Complications include brain abscess, brain damage, bone infection or osteomyelitis, chronic back pain, meningitis, and a recurrence of the infection common even if the disorder is treated, and spinal cord abscess. You must call your healthcare provider if you have persistent back pain with a fever, a headache with a fever, or other symptoms of epidural abscess as discussed before. An epidural abscess is a medical emergency. You must be seen and treated in the emergency department setting and possibly admitted to the hospital. This is it for my discussion of epidural abscess. Thank you. Bye-bye.
Education in medicine. Patients had no defined symptoms of sinusitis but had a headache and flaxing fever for 3 weeks. They had no neurologic deficit and or abnormality on physical examination. A blood chemical profile showed an C-reactive protein level of 29 milligrams per liter and white cells count of 11,900 per cubic millimeter. Computed tomography revealed unilateral opacification of the left frontal and ethmoid sinuses as well as defects in the frontal bone.
Podríamos definir la sinusitis como una inflamación de la mucosa de los senos paranasales, aunque hablamos propiamente de sinusitis refiriéndonos a ella cuando hay una infección a nivel sinusal. Los senos paranasales son cavidades que están situadas alrededor de la nariz y están comunicadas con esta por unos conductos de comunicación y drenaje. Los senos paranasales más conocidos son los senos maxilares, que están situados a los lados de la nariz y por debajo de los ojos, y los senos frontales, que están situados en la región frontal por encima de los ojos. Aunque existen otros senos, que son el etmoides, que están situados entre medio de los ojos, y el esfenoides, que está en la parte más posterior del etmoides. Las causas de la sinusitis son varias. La más frecuente son los virus que provocan un catarro o un resfriado común y que se acaba complicando con la sinusitis. Aunque otras causas pueden ser las desviaciones del tabique nasal, poliposis nasal, rinitis alérgica, infecciones dentarias, etc. Los síntomas más frecuentes de la sinusitis son, por un lado, la obstrucción nasal, después la rinorrea o mucosidad purulenta, de color amarillo o verde. Hay que pensar que un resfriado en el que la rinorrea purulenta dure más de una semana posiblemente sea complicado por una sinusitis. Otro síntoma es la presión y el dolor a nivel sinusal, o sea, alrededor de la nariz y de los ojos, que en ocasiones da cefalea, dolor de cabeza. Y otro síntoma es el malestar general, que puede acompañar, aunque no siempre, de fiebre. La sinusitis se diagnostica básicamente por la clínica, o sea, por los síntomas que he mencionado. Además de los síntomas, la exploración también es importante, y la que nos da mayor información es la endoscopia nasal, con la que podemos ver el interior de la nariz y la comunicación de esta con los senos paranasales. Cuando ya pensamos no en una sinusitis aguda, sino en otros tipos de sinusitis o en complicaciones de una sinusitis, el TAC, la tomografía computerizada, nos da una imagen exacta de lo que ocurre dentro de las cavidades sinusales. La sinusitis aguda es una infección que, habitualmente bien tratada, acaba curándose sin síntomas. Aunque el tratamiento de la sinusitis aguda hay que individualizarlo en cada caso, podríamos decir que básicamente descansa en 3 puntos. Para la infección, antibiótico. Para calmar el dolor y el malestar general, analgésico. Y para la congestión nasal y sinusal, corticoides orales, corticoides en spray, descongestionantes nasales, vaos, etc. Otros tipos de sinusitis, como la sinusitis crónica, la sinusitis fúngica o la sinusitis odontógena, generalmente el tratamiento es quirúrgico. Actualmente, la cirugía es mínimamente invasiva. Se realiza con ópticas o endoscopios a través de los orificios nasales. Han quedado en el olvido de la mayoría de otorrinolaringólogos las cirugías externas agresivas que se realizaban anteriormente abriendo los senos paranasales. En resumen, ante un resfriado con una rinorrea que dure más de una semana, síntomas del dolor de cabeza, hay que consultar con el otorrinolaringólogo.
Guys, there is specifically a terminology for you to know here in complications of sinusitis, right? Basically, here there is a term called as Puffy tumor. This one, Puffy tumor. Okay, it is complication of sinusitis. So basically, look at this one here. So in complications of sinusitis, as a local complication, there can be osteomyelitis, that is infection of bone marrow, right? Osteomyelitis, itis is any inflammation. So here there is infection of bone marrow. If it is of the frontal bone, there is a terminology called as Puffy tumor. Just remember that this is not any, it's just pus, okay, it's nothing else. So if you can understand in this diagram, okay, where is the bone? Bone is pretty clear for you, right? This thing is the bone. So this is the bone, right? Over the bone, you have a fine layer that is periosteum, right? So beneath this periosteum, if there is pus formation because of the sinusitis, right? So you can see the periosteum here. See this? This is the periosteum separated from the bone now. This is the bone, and between these two, you can see the yellow, right? That's the pus, and that is nothing but the Puffy tumor. So Puffy tumor is what? It's nothing but pus, pus. It is nothing cancerous and all that. Okay, just pus. Okay. So the person will arrive with a nice swelling here. Okay, that's Puffy tumor. If it is beneath the periosteum, it is Puffy tumor. If it is behind the bone, what is it? It is extradural abscess. If it is after the dura, it is subdural abscess. Inflammation of the meninges, so it will become meningitis, and then much deep inside, they are talking about brain abscess. And also there can be cavernous sinus thrombosis. Okay, so those will become the intracranial complications. But basically here, local complication itself is they are saying is Puffy tumor. So here there seem to be nice images of Puffy tumor. So hope you have understood this terminology, Puffy tumor. What is there in the pot? Pus. Okay.
Pros and cons. Pros. Analgesia for pains, nasal washes with saline solutions, intranasal corticosteroids or nasal disconhits may be helpful. In some more serious cases, short courses of oral corticosteroid can be very helpful. And cons, the patient was treated with intravenous antibiotic agents for 4 weeks after surgery. Osteomyelitis of the frontal bone and associated subperiosteal bases usually relate to frontal sinusitis. Intracranial extension is a potential complication.
underfloor ENT analogy. Here, floor ENT analogy, we deal with a wide variety of sinus issues, including both acute and chronic sinusitis. Some cases of sinusitis are more severe than others. Today we'll discuss an interesting case that recently managed. The patient is a 40-year-old gentleman who presented to the emergency room with a several-week history of left forehead swelling, worsening nasal congestion, and breathing. The report has dealt with sinus issues for many years. These symptoms were new to him. He denied any visual changes or other neurologic changes. CAT scan imaging showed obstruction of his left cheek forehead sinuses, as well as erosion of his left forehead bone, resulting abscess. This is known as a Puffy tumor. Despite the name, it's not actually a tumor, it's in fact an infection. Different physicians treat this condition in different ways. For this particular gentleman, he was admitted to the hospital and managed for several days with antibiotics and steroids during IV. The infection of the forehead was also drained with a needle, which was used for culture to help direct the antibiotic therapy. Once his infection and inflammation had calmed down, I performed endoscopic sinus surgery to open up the sinuses and allow the infection to drain properly. He was managed for several weeks with antibiotics, and his infection has completely resolved and he is going back to normal. Here for the ENT analogy, we see the entire spectrum of sinus disease. Some sinus disease may be managed with medication alone, others with complex procedures including balloon sinuplasty. Some require surgical treatment, such as this patient. If you suffer from sinus issues, make an appointment and come see one of our providers and receive an evaluation and personalized treatment. Florida ENT analogy. Breathe well, hear well, be well.
Issue applying in Ecuador. The average number of common colds or influenza in adults in 2 to 4 per year, in children 6 to 10 episodes per year, or of which only 0.5 to 2% are complicated by acute bacterial rhinosinusitis.
Welcome to this. Today we will be discussing the topic regarding surgery, and the topic for today is what's of tumor. The interesting thing that you need to know about this tumor is that it's not a tumor. Yes, it's a misnomer. What's of a tumor is a disease that's due to swelling. We don't have various types of formation in the scalp because there's a small bag that sections that it mostly builds on its inflammatory reason. This characterized by osteomyelitis of the bone. Osteomyelitis is the result of deep infection or transfer factor causes of both of the tumor are acute frontal sinusitis where the infection runs separate and stay with the trauma, chronic operating without distinction. Let's talk about some of the features of one. It could present as a ball swelling from the T-zone, which is painful. It also presents radioactive swelling, urinary nasal discharge, and evaluation tests and toxic, and healing. Investigations to carried out for diagnosis of testicle, reticulocyte not having a segmentation rate, both of target level and significant infection. You can also perform extra CT scan. An abscess is necessary for administration of radios to access and disease. Pots of tumor is a rare diagnosis. All central surgeons have pots of tumor. They could be trauma, primary osseous tumor, and primary flavus tumor. Before adjusted bacterial formation of pots of tumor, it is necessary time. Otherwise, it will complication. later, one can see significant polynomial growth, with the most common positive active administrative focus and as always. Other bacteria could be Hemophilus, treatment for pox Puffy tumor is drainage under anesthesia that abscess is to be drained and then proper antibiotics. The abscess has extended significantly, then neurosurgical decompression needs to be done. Similarly, in case of osteomyelitis occurs, that radical removal with construction surgery should be done, which is a major and serious type of surgery. We hope we could help you with that. If yes, please like and share.
Conclusion. Sinusitis is a common pathology in pediatric age and generally presents as a complication of an infection of the upper respiratory tract. Post-inflammatory tumor is a currently rare complication of frontal sinusitis. Early diagnosis and timely medical surgical treatment are essential to avoid devastating neurological sequels or even death of patients suffering from this pathology. Thank you.